Right, welcome everyone. We're broadcasting from various parts of the country to join you on this virtual session. I believe we can see everyone. If you're joining on YouTube, I think we can see your comments. So make sure you, on YouTube and Facebook, I believe. So I think those comments are all streamed. So throughout, just to start, welcome. And throughout the conversation, if you have questions that you think of, put them in the comments. We'll make sure to monitor the chat. So good afternoon, everyone, unless you're in a different time zone. Good morning. Happy Monday. My name is Rebecca Rear, and I'm the Director of Climate Policy and Justice at the Maryland League of Conservation Voters, serving as your moderator for this session, The Politics of Heatwave Hell in America. And I've always appreciated Dr. Wilson's get to the point in your titles session here. So we really have that. We can see that front and center here in this session. I hope everyone is enjoying the first day of the Environmental Justice and Health Disparities Conference. And I want to thank Dr. Wilson and the team at the Center for Community Engagement, Environmental Justice and Health at University of Maryland School of Public Health for hosting this conference and for their ongoing leadership on these issues. The discussion and collaboration that will take place over the next few days is a little overwhelming and exciting. And I do hope to see many of you on Thursday for the in-person sessions. I'm looking forward to those. But right now, we're going to jump into this session where we'll hear from three really interesting and dynamic speakers who will describe how historic and contemporary racism, discriminatory practices, and development disparities have made communities of color and low-income communities more susceptible to rising temperatures. Hopefully, we also get into solutions to address this inequity and offer insights into strategies for adapting to and mitigating the impact of urban heat islands. The panelists will share successful approaches from various cities to enhance the resilience of at-risk populations, particularly those facing health risks and fatalities due to heat-related issues. I'm going to go ahead and just introduce all of our panelists right now so we can dive into the conversation. After each panelist, we'll have a minute or two for any technical questions from the audience. So if you have sort of clarify this point, bring those up right away. We'll get to those. And then after all the panelists go, we'll dive into conversation. So I'll have a couple questions for them and I'll make sure to monitor that the chat. So please do make this, we want to make this participatory. I know it's virtual, but I hope to make this as participatory as we can. So make sure those comments keep coming in the chat, and I'll take those comments as they come in for the conversation at the end. So just to introduce our panelists, because you're going to get excited as you hear these bios. Dr. Renee Salas is a well-recognized expert in climate change and its impact on health, healthcare, and equity. Dr. Salas was elected to the National Academy of Medicine in 2021 for this work and chairs the Academy's Climate Change Interest Group. She has led endeavors with the world's top general medical journals, including spearheading the New England Journal of Medicine Group's Climate Crisis and Clinical Practice Initiative, and serving as a guest editor for the series entitled Fossil Fuel Pollution and Climate Change. Dr. Salas is also a member of the Lancet Countdown on Health and Climate Change, serving as the senior author in 2022. Dr. Salas is an emergency medicine physician in the Center for Social Justice and Health Equity in the Department of Emergency Medicine at Massachusetts General Hospital and Harvard Medical School. Dr. Luis Ortiz is an assistant professor in the Department of Atmospheric, Oceanic, and Earth Sciences at George Mason University and an expert on urban climate and extreme heat. His work leverages atmospheric sciences, engineering, and the social sciences to investigate how interactions between the atmosphere and built environment impact humans and infrastructure. Dr. Ortiz has worked on applications and use-inspired research through his role as co-principal investigator of the Virginia Climate Center and co-chair of the Climate Science Working Group of the New York City Panel on Climate Change, where he leads efforts to consider climate and environmental justice as a critical component of climate science research at urban scales. And Dr. Lauren Smalls-Manty is a senior environmental systems scientist at the Department of Health in the Bureau of Environmental Surveillance and Policy. In this role, she works closely with other research scientists, community stakeholders, and city and state agencies to promote equitable, evidence-based urban heat policy. Her research focuses on climate mitigation, adaptation, and resilience strategies, and specifically examines the connections between the climate, urban environment, and health. Like I said, what a stellar panel, and I am excited to hear from them, talk about issues, talk about solutions. You'll each chat for about 10 to 12 minutes, and then we'll have lots of time for conversation at the end. Keep those comments coming, and I'm going to hand it over to Dr. Salas to kick us off. Thanks so much.
Well, thank you very much, Rebecca, for that generous introduction. And I am so excited to be here with my esteemed panelists and to learn from you. And I also would like to extend a thanks to Dr. Wilson and his staff and everyone who made this possible. I know there are thousands of things that go on behind the scenes to make this as seamless as it is. So we know that the health impacts of climate change are not experienced equally. Climate change deepens health inequities rooted in systemic racism and economic injustice, and disproportionately harms communities of color, indigenous communities, and people living in low wealth communities. So that's why these types of discussions are so important. And so I'm an emergency medicine physician. That is where I began my journey and the perspective that I'm coming to with this, and I still practice. And oftentimes I feel like I'm putting Band-Aids on bullet wounds when patients are coming in. I'm not actually getting to the root cause of their problem. So oftentimes I feel like I'm standing at the edge of a river, pulling drowning patients out one at a time, only to see so many more behind them. And so it's only when we walk all the way upstream that we actually find these root causes. And the burning of fossil fuels driving air pollution and the primary driver of climate change is at the heart of our conversation today. But yet, I also want to parallel that I think what brings me the most inspiration from working in the emergency department is when the room fills with people, whether that be the radiology tech, to the nurse, to the medical student, to the pharmacist, in order to save the crashing patient in front of us. And I'm seeing this room fill for climate change. And so I have enormous hope. I want to just put that out there right now, and especially with the way that this is breaking down silos and bringing transdisciplinary, multi-sectoral conversations like this one. So heat is arguably our best studied climate exposure pathway, but our heat adaptation strategies of today are inadequate, especially for those most at risk. And I personally believe we have to strive because every heat-related illness and death are preventable. So I'm going to talk and make 3 points to kick off this conversation, and then look forward to the breadth and wealth of things that will follow. And that is first, that we have to be striving towards health protective cooling that is not maladaptive. Number 2, that we need to be generating hyperlocal data to inform locally tailored solutions. And 3, that we need to drive towards interconnected solutions that can also address interconnected challenges. So I'm going to kick this off with the first one and start where all of my shifts start, and that's in a patient's room. So I was working a busy shift when a EMS brought in a elderly man whose wife called 911 because he'd been acting confused. The EMS crew, who I knew well, the ambulance crew, said that they climbed up to the top floor of this patient's apartment and opened the door and felt like they were hit with heat from the Sahara Desert. And when they walked into this apartment, they saw that there was only a window that was partially cracked, and he and his elderly wife were sitting in a chair in the living room. Well, now with this patient in the emergency department, we quickly transferred him over and found that his core temperature was 106 degrees Fahrenheit, which in fact meant that he had heat stroke, which is really the most life-threatening form of heat illness. But I often think of that patient's wife who was left behind in that apartment. Now, the annual number of heat waves is now twice what it was in the 1980s, and heat wave seasons are over 3 times longer than in the 1960s. And there was a landmark study that showed that there's an estimated 59% increase in heat-induced deaths that are attributable to climate change from the 1990s and 2000s. And there's a 66% likelihood from the World Meteorological Organization that we could hit 1.5 degrees Celsius average global temperature. We're at about 1.2-ish right now, which means that we have to be prepared for the coming heat that will inevitably come with the extremes as we look at that average global. So, and heat is also the leading cause of weather-related deaths in the US, yet official statistics often underestimate the true burden. And heat exposure is associated with widespread health harms, including acute and chronic heart, lung, and kidney disease, but it also worsens mental health outcomes such as mood and anxiety, increased risk of suicide, increased risk of preterm birth and stillbirth, And we think about our children, it impairs their ability to learn in school and makes it harder for them to play safely outside. And we know that children, pregnant people, adults, and people living with illness are uniquely at increased risk from extreme heat. Now, of course, we know that economically and racially discriminatory policies shape extreme heat exposure, being more susceptible and being less able to adapt. And so when we think about the exposure, we know that there's systemic marginalization and inequitable community investment practices that influence how our cities are designed, which you're going to hear more about our cities, less green space, amplifying heat in some communities. And people living in communities of colors thus have been shown to be more exposed to extreme heat and thus bear the burdens of those downstream illnesses. There's actually was a study that showed the largest projected increases in heat-related mortality or death to actually are 40% more likely to be home to Black and African-American people. So we also know that people with different conditions that make them more at risk can intersect and compound the harm. So climate threats further compound and amplify these risks. So for example, due to the experience of chronic structural racism, maternal mortality rates are highest for Black and African-American people in the US. And economic and racial injustice have led to Black and African-American communities facing greater susceptibility and exposure to extreme heat, as I already mentioned. So these overlapping forms of injustice compound, thus increasing the risk of extreme heat exposure during pregnancy and preterm birth may be stronger for Black and African-American people and those in low-wealth communities. Now, when we think of those, so that's sort of, are they more exposed? Are they more at risk due to underlying factors, which are all interconnected? And then last, when we think about adaptation strategies, again, this ties directly into our solutions because we have to understand the adaptation piece. So there is an inequitable access to effective, reliable, and affordable cooling strategies, including both community level strategies that cool neighborhoods in response to heat, such as cooling centers. And low wealth households are less able to access health protective cooling when we think about heat pumps. And the cooling benefits of fans in very humid conditions. So for example, one study and review in the Lancet said of 108 degrees Fahrenheit, which is 42 degrees Celsius with about 50 to 70% relative humidity, that actually the benefits of fans are really eliminated in older adults over the age of 65 because we sweat less as we age. Now, we know that the energy equity gap, so the difference at the threshold at which a house is going to turn on an air conditioning does vary. And there are going to be financial constraints because many households will limit the use of electricity, not by using or deferring the use of AC, by deferring the use of AC during hot temperatures. And one study found that a large energy equity gap in low wealth households, as well as Black and African-American households. And these, and so this just showcases one that air conditioning is also a sort of maladaptive intervention. So the Lancet Countdown actually tracks and has found that the use of air conditioning contributes to air pollution, which thus kills and is linked to mortality with that air pollution exposure, which is coming from households or impacting households that often are not producing it because it's coming from the fossil fuel or the energy plant, which is often sited next to these communities. And so when we think about some examples in Arizona, there was a record-breaking heat wave that had 522 heat-related deaths. And over 80% of the people that suffered an indoor heat-related death in 2020 had an AC unit present within their building, but 2/3 of them were not functioning and 1/3 were not running. So, and there was one study that also showed using weather data from Chicago and Detroit and Minneapolis and Pittsburgh that they had a 5.3% higher heat-related mortality. The Black persons had a 5.3% higher heat-related mortality than white persons, and almost 2/3 of this difference was potentially explained by the racial disparities in access to air conditioning. So as we talk about what health protective cooling means, we know that air conditioning is going to be essential as we rapidly, deliberately, and equitably transition to zero emission energy sources in devices like heat pumps. And we also want to make sure that we're not contributing to the problem, but it has to be used, and the metric has to be, in my mind, health related and a health metric, because that actually can then translate to health protective cooling, that we know it's being used in a way that is preventing illness and death. And so it shows that we must have, which is why I'm excited for this conversation today, a multi-pronged, evidence-informed policy approach to health protections from extreme heat. And again, striving so that way every heat-related illness and death are preventable. I just want to touch on two other small points. So again, really bouncing back to my second point, which is that the importance of hyperlocal data to inform locally tailored solutions. This case is actually from a colleague of mine, Dr. Jeremy Hess, who works out in Seattle's Harborview Medical Center, which is one of the region's premier trauma hospital. And so during the really, at that time, unprecedented heat wave that happened in the Pacific Northwest, where there were 6 days of excessive heat in June of 2020 that led to absolute temperatures up to 116 degrees Fahrenheit in cities such as Portland. And again, this heat wave was found by scientists to be virtually impossible without climate change. And they had ED visits that were nearly 70 times higher than what it was in 2019. And he said that the ambulance teams, this is a quote from the article, ambulance teams were run ragged, transporting critically ill patients who'd been intubated in the field. One area hospital was low on ventilators, while equipment at others was breaking in the heat. Hospitals were nearly overwhelmed. Now, in July of 2023, the Southwest also had heat waves that were found to be virtually impossible. So we have a theme here, unfortunately. And their temperatures exceeded 122 degrees Fahrenheit on the 16th of July in Death Valley. And there were other parts that had all-time highs, such as in Colorado and New Mexico, and nighttime highs in Arizona, where it was 90 degrees Fahrenheit was the longest record without breaking. So when we think about, though, just the peak of heat-related hospitalizations, they actually occur very differently in different parts of the country, in part due to adaptation and experience with this heat. So in the Northwest, a study actually found that peak hospitalizations, so when people were admitted to a hospital for heat, was at 80 degrees Fahrenheit for the Northwest, but was 100 degrees Fahrenheit for the Southwest. So while they both had record-breaking high temperatures, they mean very different things to those different communities. And that study also found that oftentimes heat warning systems were activated after the peak of people who were hospitalized. Now, we also know that red line neighborhoods, which is a now outlawed racist housing practice that supported segregation and limited the economic opportunities available to Black families and other communities of color, that they are hotter than other areas within the same city. So it can be a 20 degree Fahrenheit difference, for example. And rarely these heat warning systems are driven by health outcomes. It's not always necessarily specifically tailored to a hyperlocal location and doesn't take on individual risks like I talked about. So this just highlights the importance that we need hyperlocal heat-related health data to understand those at risk and really drive those solutions, and the importance of integrating real-time data between public health monitoring and emergency departments and hospital settings, individual screening in medical facilities, and then really evaluating those real time, such as cooling centers, to see if who needs to be going or actually the ones going. My last point is going to highlight the final thing, which is that we have to drive towards interconnected solutions that can address interconnected challenges. And so my final case is a young girl who came in 4 years old for an asthma attack. And her mother looked at me and said, it was her third visit this week. She said, I have done everything that the doctors have asked of me, and she just keeps getting worse. What am I missing? And I thought about that long after they got admitted upstairs and actually looked up her address, and she lived in a previously red line neighborhood. Now, that had significant implications for her, but I think most pertinent for this discussion today is the fact that, as I already mentioned, because those neighborhoods can be, due to man-made materials and lack of green space, can be hotter than other areas, that can accelerate the formation of ground level ozone, which is formed from chemical reactions from pollutants that are sourced from the burning of fossil fuels, especially gasoline and diesel, so cars, and she lived right next to a highway. And that has been linked to pediatric asthma attacks in her hospital, and I contributed to her hospitalization in this perfect storm of events. And so we know that not only are those types of exposures, but also other compound events that are associated with heat, such as droughts or wildfires. And both of those have air quality impacts. If we think about wildfire smoke or dust. And so we have to think about holistically about interventions. It's important in order to keep that individual in a health protective cooling environment, but we also have to think about these other interconnected risks, such as air quality. and protect them from those harms. So what my patient needed was home weatherization and an air filtration system. So I hope those mothers' words, what am I missing? I continue to ask myself that question in conclusion. And I really look forward to us helping to identify what these solutions are and the path forward. And so hearing from my esteemed panelists. And so in conclusion, striving towards health protective cooling that is not maladaptive, generating hyperlocal data to inform locally tailored solutions, and driving towards interconnected solutions that can also address interconnected challenges. The room is filling, and I look forward to ours. Thank you so much.
Thank you, Dr. Salas. A technical question, or maybe, I don't know, it's super technical, but are you seeing, as a practicing emergency room physician, are you seeing your hospital change the way it prepares? If you watch the weather, just sort of the prep team at your hospital watch the weather more closely now and sort of know when to anticipate excess admissions based on a coming heat wave, or have you seen changes in the way your hospital's preparing, knowing a heat wave might be coming, and are you seeing differences in the way your hospital prepares? And then are there specific ways that hospitals serving the populations you mentioned who are particularly at risk or experiencing compounding impacts can prepare, in watching the forecast and seeing when a heat wave is expected?
Yeah, thank you for that question. It is something that is really on the forefront of everyone's minds. And I know that there are some key examples occurring in different locations. I think, personally at my hospital, we get the heat alerts that are coming out from the public health department. And so those are always forwarded to all our entire emergency department staff, from the nurses to the doctors and beyond. But I think in my mind, sort of the important thing is we have to try to make this easy for clinicians and make sure that people don't forget we're all human. And so, for example, my patient came in, had a temperature of 100, well, it wasn't 106 degrees Fahrenheit from either a ear or sort of skin temperature. His internal temperature registered much higher, but he had a fever. And in my mind, if we're above sort of that geographically, locally relevant heat index level that we know is causing health harms and people to have disease and or death, that, for example, and I don't know of this done, I look forward to hearing if it is, but that could actually flag, for example, the triage nurse to then say, we've above that threshold for heat related illness. And so we have to ask that follow-up question of what type of environment was this patient found in? Obviously, he'd been sitting in an air conditioned apartment. Then, he may have a urinary tract infection or something like that was causing a true fever. But in his case, it was heat stroke. So I think there is definite opportunity for us to be able to embed all of this data that is into a system in order to make sure we build a Swiss cheese model so it isn't missed and we can optimize the health and, again, prevent, in my mind, every heat-related illness or death.
Got it. Thank you. All right, Dr. Ortiz, ready?
Thank you. And thank you, Renee. That was impressively. I don't know how I'm going to even follow up after that, but we'll try. I think a lot of what I'm going to be talking about is a nice follow up to some of the points you were making earlier, which basically where you live matters, and where we've invested for different types of solutions and different types of infrastructure matters. And I'll be talking more specifically about the case of cities, which sort of occupy a very curious space in between climate science and engineering and social science, public policy, urban planning, you name it. And it's this place where all these sort of practices sort of combine to form all sorts of disparities in the way we experience various hazards related to the weather. So with that, let me move on. And this is a very busy slide, so I don't want folks to just get too hung up on the details. But the point I want to make with this is that cities modify the local climate at various scales. You can think about a whole neighborhood modifying the way the wind flows, causing turbulence, different buildings shadowing one another, buildings, especially in the Northeast United States, where I'm arguably located, are built to hold on to a lot of heat. So they're made of brick or other sort of a high heat capacity material. So they're very good. They're essentially heat batteries. So they're very good at holding on to the incoming energy from the sun. On top of that, we as humans have become very good to some degree at changing the laws of nature and how heat moves between the inside of a building and the outside, using this technology we call air conditioning, which is essentially moving heat from our indoor spaces to our outdoor spaces, which in turn adds to sort of the ground level or the outdoor experience of heat. And on top of that, a lot of the technologies we use are not just adding heat, but also adding humidity. We're sort of moving all this energy and water from our buildings to the outside of to the outdoor world. And it is a adaptive technology, but at the same time, it's what some call a maladaptive technology because it comes with a lot of other sort of issues, such as increased carbon emissions from power plants, all the way to even worsening sort of the experience of heat outdoors. But none of this is very new. We've known that cities are a little bit different, and we've known it for well over 100 years. There's this quote I like to include in a lot of my talks from the 1800s, where I put Luke Howard here, but technically Lord Luke Howard wrote these two tomes called The Climate of London, where he essentially instrumented the whole city of London with thermometers over a period of some years, and then he found under various circumstances and different sites, instruments, and positions of the latter that London is always warmer than the country by some degrees Fahrenheit. I'm always blown away by the three decimal points here for the 1833. But yeah, but the point here is we've known that cities are warmer, and there's something different about what makes cities cities that makes them warmer for a long, long time. And what because the way we build cities is different depending on where you live. And Dr. Salas made a really good point of some of the practices that have historically led to differences in how we build our cities. For example, the practice of redlining, which has led to disinvestment in many neighborhoods historically. So even though it's illegal now, we still live with sort of the legacy of that sort of historical disinvestment and lack of green spaces, lack of street tree canopies and stuff like that. And to this day, what that means is that people of color who often live in those historically disinvested neighborhoods are exposed to higher temperatures than those than typically white communities in non-redlined neighborhoods. And what I'm showing here is a piece or a portion of a graph from a recent article by Sue et al. That looked just at that sort of a difference between exposure to extreme heat from different populations. The blue curve here is sort of the distribution of the heat island intensity or how hot it is in a city compared to its surroundings in places where non-Hispanic white people live. And if you want sort of the easy way of reading that, you can just look at sort of the center of that little blue mountain there, sort of like the average of that exposure. And then if you want to look at where people of color live, you can look at sort of the peak of the red curve or the red little mountain there in the graph, which is a little bit further to the right. And what this graph tells you is that people who belong to different types of communities are exposed to heat in different ways. And this happened. This was shown or studied through many different cities in the U.S. I believe they had instruments and satellite imagery for well over 100 cities. So this is a widespread issue. We also have disparities in our current adaptations to extreme heat. We're talking about air conditioning, which sure, it is a maladaptation in the sense that it moves heat outside, so it worsens the outdoor air and it causes more carbon pollution and air quality issues from added energy use. But at the same time, it saves lives. And it's our current sort of tool that we use to address extreme heat exposure most often. This is a figure here of the percentage of homes in New York City that don't have air conditioning from a study, I believe, from one of our other panelists' team, the New York City Department of Health, who showed that those locations with the highest non-adoption of air conditioning, and I'll show you to those. I'll point you to those sort of darker red or brown areas near the top in the South Bronx and parts of Brooklyn and Queens. There are also places with the lowest income in the city, and it's also where the highest heat-related mortality happens. They also happen to be, or not happen to be, they are also neighborhoods with majority households of people of color in New York City. So we could ask a question, and we have the tools to sort of answer and get at the answer. What if we gave everyone AC? So, right, if it's our solution of choice, and we know that it can actually reduce some of the health burden, with many caveats, as Dr. Salas mentioned earlier, with the whole energy gap and sort of the economic burden that it can place. Well, what happens if we gave everyone AC? Well, first of all, it's sort of like trading a health burden for an economic burden. You're essentially paying your utility bills and to maintain a level of comfort in your home, or a level of life-saving thermal environment in your home. And we actually ran simulations over New York City to look at what that might be, what that energy burden might be for various locations in the city. And we found that, well, not very surprisingly, the lowest income, the neighborhoods with the lowest income households do have the highest burdens. And then if you were to apply sort of climate change signal and sort of run the same simulation, but with a warmer environment by end of century, and calculate that same burden with the same population, we found that not only are those locations where those low-income people or communities with large amounts of people of color have the highest burdens if we were to give everyone air conditioning, they also see the highest increase in burden as a function of the warming summer due to climate change. And what I'm showing here is sort of that relationship between the household income and the change in air conditioning related energy burden. So essentially, as you go into lower and lower incomes towards the left side of the graph, the change or your increase in burden would be higher and higher as our summers become warmer due to global climate change. But that's not the end of it. Giving air conditioning to everyone also has effects on our environment, on our outdoor environment. It increases what we call the energy fluxes, or how much energy is going from the outside to the from the inside to the outside in those particular neighborhoods that already have low adoption, which is not very surprising. If there's a location that has less air conditioning and we were to give them all air conditioning, that's clearly where you would see the biggest difference. And if you only were to care about how much overall the city would increase its temperature, then you would only see sort of a less than half a degree Celsius increase. However, if you were to go over to those neighborhoods that see the highest adoption, then you would see, on average, at least 1 degree Celsius increase in outdoor temperatures. So air conditioning comes with sort of these trade-offs in terms of what it gives us, but also what we lose and the price we pay for this kind of technology adoption. We also are able now to look at in more and more detail sort of how these exposure and lack of adaptive capacities are distributed in particular locations. I'm showing 3 examples here from the urban heat island mapping campaigns that NOAA, in collaboration with a host of partners through very large citizen science endeavors, did for various cities. They did them for a lot of cities, but I'm a part of the Virginia Climate Center, so I have to use 3 Virginia cities as an example. But you can see in these locations the level of detail that you can sort of go in and map temperatures. And the reason I'm sort of shifting gears from air conditioning and temperature exposure to sort of mapping is because in order to tackle this issue, you can't just rely on what we've been relying on in the past. We kind of have to deploy a portfolio of solutions. Sure, air conditioning is probably not going to go away anytime soon, but we can start thinking about, as we sort of redevelop, construct new buildings, how do we create new places where we don't need as much of that energy of air conditioning that is so maladaptive. We can start looking at places where can we put urban parks and green spaces, street tree canopies, and get the most benefit out of them. And those kind of mapping campaigns, those kind of modeling solutions help us really do that in finer and finer detail as the technologies progress. And with that, I think I'll let you off with this sort of a forward-looking, with the final points being, yes, we have these issues of extreme heat and disparities in extreme heat in our cities. Our current solutions come with some terrible trade-offs, but that's not where the story ends. We can do a whole lot more. We can change our building practices. We can change our urban planning, our zoning, so that we can start addressing them in the places that are needed most. And thank you.
Great. Thank you so much. Question for you. So just this morning, I attended a meeting of the Maryland's Air Quality Control Advisory Council, known as ACAC, which I think is one of the better acronyms out there for a state council. But so at the ACAC, they were talking about the proposal for Maryland's building energy performance standards. And it's part of a big climate law in Maryland that passed, and it requires the state to put forward building energy performance standards, essentially electrifying buildings as a climate solution. And so just wondering, in your work and modeling and looking at, how does building electrification play in as a solution? Have you looked at that? What are your thoughts there? And I'm asking in part because it's a very, real time, folks are considering how to promulgate those rules, here in Maryland.
So I'm not super familiar with the sort of the building infrastructure in Maryland, but in general in the Northeast, electrification really tackles winter heating. And there's a lot of good or a lot of positives that you can get out of it. Namely, so when you're using sort of a boiler system or so that it burns anything in buildings, you have large air quality issues in the winter, especially. So you kind of get rid of that to some extent by electrifying. You also get rid of a portion of the amount of heat that we push into the atmosphere when we are running all these kind of heating systems. Essentially, I talked that we kind of tame the laws of physics earlier to cool our indoor, or even to essentially condition our indoor spaces. But the way we do that is we add more energy to the system to sort of move the heat out or the cold air out of our buildings faster and make it more comfortable. So we no longer have to add that amount of heat. We add energy in some other ways. And that might have some benefits in terms of the urban heat island, for example. There are some challenges that are more sort of energy transition based. For example, if you do a large energy transition, a large electrification effort in a place that is mostly fueled by coal or oil or natural gas power plants, you're essentially increasing emissions from those power plants as you electrify, because with electrification comes added energy demand from electricity. So you're kind of shifting some of the emissions related to that to where the power plants are. So there might be a period where those actually get worse if you're not sort of transitioning those at the same
I was
time.
going to say, unless you pair it with a 100% clean energy campaign, which is where groups like Maryland LCV come in. But exactly, because as we see the increase in electricity from this push for electrification of our vehicles and buildings, we need to pair that with 100% clean energy. And I just want to talk about one thing you mentioned about air quality. That's where I'm, really starting to understand the benefits of electrification. Yes, to our climate, but to indoor air quality is really where we're seeing a big benefit of these electrification policies. This changes and improvements in indoor air quality too, which is, when you can get that win-win, when you get that, it's actually win-win-win. It's economics, it's on the long scale, and in climate and indoor air quality. So anyway, just any closing thoughts on that before we move to our next speaker? And I think you have to stop sharing so then we can get our next. Oh, there we go. Wow, very queued up. Sorry, Dr. Ortiz, any closing thoughts on that?
No, I think you encapsulated it very well. There's a lot to gain from electrification, and there's a lot to gain by sort of looking at sort of that portfolio of solutions outside of just thinking about one silver bullet. So yeah, thank you so much for having me.
Thanks. All right, we're getting our next speaker, Dr. Smalls-Manti. Over to you.
Hi, I feel like the first two talks were a great introduction for what I'm going to talk about, which is translating some of the research into policy. And Dr. Renee also gave like a very good general overview of all of the stuff that we can do and what we should do. So at the New York City Department of Health, I work at the Bureau of Environmental Surveillance and Policy, where we have an environmental heat and data portal. And so I'm going to be talking a little bit about some of the data and how we use that data to translate it into policy. And we've done, because heat is one of the most deadly natural hazards, we've done research on heat and health for over 10 decades. So we right now able to do time series and look at over time heat mortality, hospitalizations, or ED visits due to hot weather. So this is one of our pages, and Dr. Ortiz talked a little bit about heat risk in New York City, and we've developed a heat vulnerability index, which is shown here. And so, as he was saying, the darker areas are where you have a lot of, due to structural racism, you have a lot of disinvestment in the neighborhoods, racist housing policies, previously fewer job opportunities and lower pay. And this put people at risk for heat related deaths during hot weather. I chose a neighborhood which is in the South Bronx area, and it has our highest vulnerability in one of the highest vulnerabilities in New York City. And if we look at some of the factors that affect heat vulnerability in our neighborhood, so we were able to collect different data pieces and put them together to study how specific neighborhoods have heat risk. So some of the parameters are temperature, surface temperature, air conditioning access, green space, and income. And as previously mentioned by, I think, Dr. Salad and Louise, these Black New Yorkers experience heat stress that's at twice the rate of white New Yorkers. And so a lot of these areas is where you have the Black and brown communities that are in the darker shades. So now let's go to street design. So New York has a lot of streetscapes, and in many cities there are a lot of different urban morphologies that will lend different heat fluxes in the city at different times a day. So I have here a comparison between two streets. So one street you can see has very little tree canopy and different types of housing structures. And then another street has overarching canopies and more single family homes. And so some of the streetscapes that impact heat are, for instance, building materials, street direction, the surface of the street material, whether it's asphalt or other colored surfaces, sometimes heat generating actions, which was previously discussed, such as air conditioners. And I think there are a couple ACs that you can see. New York City has an old infrastructure, so a lot of times the only option is to do the window ACs, but we're working on policies to help retrofit some of the buildings to more efficient units such as heat pumps, or helping people weatherize their home better. Some other factors include building height and color, and as previously mentioned, tree canopy or vegetation presence. And so just below, I have a thermal image. If you could see the differences, you could see the surface temperature differences of even just the building color. So the white color is a little cooler than the brownstone color. So in New York City, we were able to implement a comprehensive heat and adaptation and mitigation program called Cool Neighborhoods NYC, which was initiated in 2017. And it allowed us to do not only do a suite, or as was previously mentioned, a portfolio of strategies. It allowed us to actually do some research on how these different strategies impact the neighborhood. So we're able to tailor certain strategies to neighborhood or certain populations at risk. So initially we did want to collect a baseline. And so we went into neighborhoods that were medium and high heat vulnerable, and installed around 500 temperature sensors on light poles and street trees. While this was a labor intensive process, we did it for 2 years, but now we're able to actually model the air temperature in these neighborhoods from this baseline temperature. So we don't have to do it every year. But what we did find was that even during the nighttime, so at day, of course, you would have, differences related to the thermal capacity of materials, but even during the nighttime, we could see that neighborhoods have different rates of intra-neighborhood air temperature variability and inter-neighborhood variability. So between the different neighborhoods, such as if you go into Manhattan or Bronx or Queens, which are some of the boroughs in New York City, but also within the neighborhood. So if you're going block to block. And we also, at the health department, as previously mentioned, look at heat exacerbated deaths. We're city mandated to publish a heat mortality report every year. But one of the important findings that we found in this year's report is that even that while during extreme heat days, which are the red dots on the graph, you can see that the number of deaths, so if you look at the right portion of the graph where we have the section out red, the number of deaths during hot weather, extreme weather, hasn't really increased. So greater than 95. But what we have seen is The orange dots, which represent the number of heat exacerbated deaths during relatively hot weather, so above 82 degrees Fahrenheit, has increased. And so this has important implications for instance, what some of the weather that we've seen in the New York City area or the Northeast area this year, while the West Coast has seen very extreme temperatures. Actually, for us in the Northeast region, we didn't have a lot of extreme heat days, but we had a lot of hot weather days for long periods of time. So the days within the yellow regions. And so while this tells us also a little bit about our current strategy in responding to extreme heat and how we should open resources and utilize resources for the future to address all risks due to heat. So I know this was touched a little bit about before, but I do want to talk a little bit about the indoor environment. So we see in New York City, the AC prevalence, the low AC prevalence is actually very similar to the in neighborhood areas to the areas where we have high heat vulnerability. If you look at the two maps, for instance, like the South Bronx or in some of the Brooklyn and Queen areas. So we were able to, during COVID, implement an AC distribution program to seniors, and we distributed around 70,000 ACs because those are the people who are most at risk during COVID because they couldn't, the cooling centers weren't as accessible, but people were still in their homes. And so through this, we also did an evaluation, and we were able to ask the residents a few questions. And you can see just receiving an AC and being able to turn it on, respondents were able, participants, which are shown as the blue, were able to feel better while staying home during hot weather compared to participants who were not able to receive an AC because they didn't qualify. We also looked at challenges to getting an AC. So for instance, we asked the respondents a couple of questions. If they couldn't afford, if cost was the issue, or were there physical barriers and limitations to getting the AC. But as you can see, regardless of whether you were in the Get Cool participant group or not, the additional costs required to actually run the AC is still a concern. So we work a lot with some of the federal and state programs that allow participants to get energy savings for their households. And as previously mentioned, we want to develop comprehensive strategies. So it's not only about, one tailored thing. While we're working on the indoor environment, we want to work on the outdoor environment as well so that we can find holistic solutions for neighborhoods. So the Cool Neighborhoods program, which was launched, and a lot of these mitigation and adaptive strategies still continue today, involved a whole suite of programs which have helped to lessen the heat burden for some New Yorkers, for heat vulnerable New Yorkers. That's it.
Excellent, thank you. You showed a lot of maps. You're part of a health department that uses mapping. How can, in the University of Maryland School of Public Health, Dr. Wilson's team has a climate and health environmental justice map, and the Maryland Department of the Environment is developing one. So how can people listening, use mapping tools to help advocate for solutions in their own communities?
Yeah, I think the first thing is making it accessible. So making sure that community members can easily access it, which is why we have the Heat and Health Data Portal. So you're able to quickly go on and click whatever variables you want to do map layers or download. Even downloading the source data is available, so you can create your own maps on your own program. So accessibility is really important to making sure that communities are engaged. And even the study that we did with the ACs, if you're going to do a study on a community, the feedback is also important. So we made sure that we went back into the community to do education, make sure that they are aware of the resources that they do have and how they can better protect themselves from heat.
Great, thank you. I want to encourage folks listening to make sure if you do have questions, you're typing them in the chat. I do see we have a question for me, which is, and if you want to stop screen share, I think our faces become bigger for everyone. But the question is LCV considering biofuel and anaerobic digestion of livestock waste a green energy solution? For a little context for folks, that comes from Maryland has a renewable portfolio standard as part of our clean energy goals that requires 50% of our energy come from renewable sources by 2030. That includes a 14.5% solar carve out, which is great. It also in tier one energy sources includes burning of trash, poultry litter, and woody biomass, other biofuel sources. Maryland LCV advocates for, so that's tier one means that the state is investing in those sources of energy as tier one renewable sources of energy. The question is specifically, is LCV considering? So Maryland LCV's position is we want the state to invest in truly clean renewable sources. So that's wind and solar. So that may require a revisiting of the tier one sources in our RPS, but the what we advocate for in 100% clean is really is reaching that goal in a way where the state is putting state money and state investments and including accessing federal dollars into truly clean renewable sources, which is predominantly wind and solar. So that's the answer to that question. Every state has a fun and unique RPS for those states that have them. So I encourage folks to get involved in your state energy advocacy work to make sure that, and actually in Maryland, there's a unique opportunity to do so right now. We passed the Climate Solutions Now Act in 2022, major implementation efforts going on right now. The Maryland Department of the Environment is taking comments right now on how the state is going to reach its emissions reductions goals of 60% by 2031. So you can put that comment into the Department of the Environment right now as part of this work. So sorry for that sidebar. Question for our panelists. We have about 15 minutes left for our conversation. I found it really interesting that the different sectors you represent. So we have medicine, academia, and sort of a government public health department all represented here. So I wanted to ask your thoughts about how collaboration. So Dr. Salas, you already mentioned, your hospital gets the public health department's heat, warnings sent around to your department. Are there other types of collaborations we see among different sectors? And so what's working well that you're seeing in terms of collaboration among sectors? And then maybe who's not at the table yet that really is a player you see that should be more engaged in this work specifically for heat and protecting folks as we see increasing heat. So that's for all of you. Anyone can go first.
I can jump in. Well, thank you both for fantastic presentations. And as always, it's an honor to learn from you. And I think I was just struck as, when I have a patient crashing in front of me in an emergency department, I don't weigh the options of, should I do treatment A, B, or C? I use all three at once. And so I think this theme here of portfolios and multi-pronged approaches is so key. And so as we heard about how we can really adapt our public health and urban environments is so important. But I'm thinking about from a medical side, what do we need to be doing to help contribute to that? So when we think about the energy burdens of running either a heat pump or air conditioning, well, what if physicians could prescribe a heat pump and health insurance companies could subsidize electricity to ensure that there's health protective cooling? Now, arguably, the return on investments, I haven't seen that done yet, but I would love to see that if it's out there. But arguably, the return on investments would be much more than a hospitalization that's from heat-related illness. So I just see that there's such immense opportunity to really try to have this multi-pronged data-driven approach, but it requires conversations like these and getting different people to the table. And so also when we're thinking about where should we be prioritizing renewable energy and what energy production site should be converted to renewable first, well, obviously those that are contributing to air pollution deaths within communities who are contributing the least to that energy production, that as we think about increasing electrification, that air health-related data from the air pollution, health harms, and death should be driving where it is that we are investing, making those investments first. So anyways, I see an enormous plethora of opportunity here. And I really think climate change can kind of break down those barriers in order to bring us to the table to solve these interconnected challenges. And so I'm just really excited about the moment we're in. And I think we create a vision for the future and we can transform it together.
I can add in a little bit. It's a funny question you asked this because the study that I was referencing on air conditioning adoption actually came from a collaboration with the New York City Department of Health, where Lauren Small-Smith is situated with some of her coworkers, or at least the idea for it actually came from several conversations we had with them. So that's part of, or one of the ways that academia can sort of engage. We are sort of tied that we cannot do sort of advocacy work as a public university, and most public universities are in that situation. But we can inform, and we can dig deeper or dig very deep into questions that are policy relevant. So engaging with our local policy makers and stakeholders, and drawing research questions out of that is one way that academics can sort of move the needle a little bit, providing technical assistance when the communities around us try to go for infrastructure grants or climate pollution reduction grants, all this sort of plethora of funding that is coming from the federal government, and making sure that they have all the information they need to make a good case for those competitive grants, especially in disadvantaged communities that may not have the capacity to look into benefit cost analyses and all that kind of stuff, because they have maybe one planner for the whole community that is in charge of everything. So we see a place for academia to sort of fit in that sense, even though we cannot technically advocate one way or another. But we just get fired afterwards. But yeah.
Yeah, I mean, as a government entity, there are some things that we cannot participate in, but it doesn't mean that we can't still be at the table. So even if it's an advocacy group, you're still, maybe we can partner with them on another research project or something to inform, like as previously mentioned, inform them of, so we can make research-based informed policy and push that policies that make sense.
That's great. One thing that struck me from this conversation is every heat death is preventable. And the title of this talk is Heatwave Hell in America. And it's truly for some people, when you lose someone or when you experience, a near-death situation because of exposure to heat, it changes your life. And so what is your reaction, to that? I just had a visceral reaction, and you hear every heat, you hear about sort of mortality as well as, impacts to sort of ongoing quality of life from the heat. So I just want to get sort of your thoughts and reactions around what would it look like? What would it take to get to no deaths from heat, because it's every death is preventable. Like what does that look like? What does that take? Thoughts there? Small question. Stumped you? I don't know. What and it doesn't have to be a one solution, sort of. So like what are some steps that you think if every one of those deaths is preventable, what are we doing? What are you encouraging folks listening to do?
Yeah, I'll jump in first, but I would just say that it's transforming the system. I mean, I think it's the recognition that what we have considered in medicine as social determinants of health, so upstream in the river, and arguably sort of beyond where, the amount of money that we're investing within the American healthcare system. I mean, we spend more than any other country, and arguably have not as optimal outcomes. And so our life expectancy is actually dropping, even with the COVID-19 pandemic, where other similar countries have already sort of had an uptick back, rise in their life expectancy. And so I think it's recognizing that we have to take a holistic approach in medicine. What we are currently doing within the medical system is not working. It's not equitable, and it's not serving those who are disproportionately suffering the most. And so it's addressing those social determinants of health, which again, sort of that all of the things when we talk about housing and diet and access to adaptation for climate change. It's addressing all of those things. And that's how we can make where arguably we can prevent every heat-related death if we're providing all of those supplementary necessities that are essential to health and well-being.
And we heard a lot about different groups of vulnerable folks. I didn't hear, and maybe somebody mentioned it, but outdoor workers. So when we think about agricultural workers, we think about contractors, construction. Are there things we could be doing, whether it's local, state, federal government, safety standards, or sort of recommend employers? Sort of what are you seeing that's working well? I think it's just another vulnerable group that I don't know that we've sort of fully brought to light here.
Oh, I think so. And we've actually done quite a bit of thinking about this in our communities, because we have so many different types of workers, and New York City is always building. So other than the current OSHA standards, making sure that workers know the options for when there is hot weather, to make sure that their employers are held accountable for the current standards that are in place, and looking for new solutions and adaptation strategies to help people cope better for outdoor workers.
Yeah, and I know that there was an advance notice of proposed rulemaking, which is a very jargony way of saying that OSHA, the federal agency in charge of overseeing that workers are not being exposed to a variety of problems, including heat, including pollution, including all manner of issues on extreme heat, not just for outdoor workers, but for also indoor workers who are exposed to heat as well. People like warehouse workers in non-air conditioned spaces and stuff like that. It has not moved to an official rule as of yet, but it certainly is something to keep an eye on. It seems the federal government is thinking about this, and it's moving forward with some regulation to improve or put added enforcement powers on extreme heat.
That's great. And then we talked. I know we heard a little bit about climate change and mental health, and specifically heat and mental health. So, and I know we see on high heat days, we see higher incidences of road rage, so traffic accidents, higher instances of domestic violence. And so are you all working on heat and mental health protections What does that look like in your field?
So we more so look at heat in relation to, I guess it would be in mental health as an overall umbrella. So a lot of our studies that we've done, we've looked at heat and heat linked to anxiety and stress. And so it's not only anxiety and stress during hot weather, but also the anxiety and stress of deciding where to go to get cool. How am I going to pay for this? Like those added burdens, cooling burdens, and challenges that exist during a heat wave event, or as I mentioned before, just during hot weather in general. And so we do we do see an increase in anxiety and stress during that period.
On our end, we just had a multidisciplinary meeting on the topic of extreme heat and learning environments. There has been some work showing that outcomes from learning, from testing, are lower when students are exposed to extreme heat. But it's admittedly an area where there are a lot of research gaps, and we're currently sort of trying to scope out what that sort of a research agenda that addresses that might look like. In the meantime, just a few weeks ago, several schools here in the U.S. Closed because of extreme heat in Ohio and in other parts of the U.S. and Puerto Rico, because they don't have schools with air-conditioned rooms. So it was a pretty mean heat wave a few weeks ago, and that was one of the sort of preventive measures because they didn't have any other ways of addressing this. In particular, in places like Puerto Rico, that a lot of public schools don't have air conditioning to begin with. Even they might not even have the infrastructure to support air conditioning. It's a massive justice issue there. That might be hindering some of the outcomes from students coming out of that public school system, and there's a lot to be done to address those gaps and just huge justice issues in those places.
Yeah, thank you both. I'll just add that climate change is sort of that meta problem, so underlines so many other problems and threat multiplier of making them worse. I think that heat is on mental health is really another key example of this, that we have this existing and growing mental health burden that is being exacerbated by extreme heat. And I think from a standpoint within the medical system, I mean, our infrastructure with which to appropriately manage and provide the care needed for the current mental health burden is far inadequate and often does not reach those who need it most. And so it's critical, especially as we see these different stressors and threat multiplying effects happening with climate change, with which to address that underlying infrastructure to make sure we can care for the other root causes that are causing the existing mental health burden, and then also being able to appropriately manage these different multiplication effects that are happening.
Yeah, and someone, Abby in the chat just pointed out Baltimore City had a school closed because and I remember I grew up and went to school in Baltimore City, and I remember that schools would close if it was 90 degrees before 11 a.m. School was done the day. And I remember watching the clock and watching the thermometer and saying like 90 before 11, come on. And looking back, of course, well, yeah, when you're in school, you want to leave. But now I look back and think, goodness gracious, how many days are going to be above 90 by 11? And if we're closing schools every time that happens, are we, what does that mean for education? What does that mean for kids in schools? Maybe it's who don't have AC, or, it's like, and thinking about the inequity there, and thinking about could that rule even be in place today, if that many days we're going to close. So we're approaching the end of our panel. My last question, lightning answers, heat and air quality are linked. I got a lot of alerts this summer from the daycare. Kids are going to stay inside today. Air quality, red alert, air quality, orange alert, limited time. And every day that happened, it was urgent, urgent, urgent. And by the end of that, I was like, all right, you know what? I get it. The air quality is bad today. You're keeping the kid inside. I trust you. My kid is safe with you. And I was getting a little urgent worn out, which does not detract from the importance of the alert or the seriousness of the threat each day. But every day, and you sort of stopped paying attention to the urgent part because it was urgent every day. So what is your advice for communication on the importance of these safety provisions when it feels like you're getting these alert, sort of the urgent becomes the everyday? What's to close on that? What are your thoughts on keeping people engaged and safe when sort of the urgent is the everyday?
I'll give a quick answer, and it sort of ties into your other one about who else needs to be at the table. And I think that's social and behavioral scientists and communication experts. We do not have time to do this wrong the first time. So we need them at the table to make sure we are disseminating this information in a way that changes behavior and protects health.
Yeah, I completely agree with Renee's point. This requires a multidisciplinary approach. Atmospheric scientists may not have the answer to that, but communication scientists will, right? And we all need to get together and talk about it and work on this problem together. It's a hard nut to crack for sure. Yeah.
Yeah, I think it's part of the human adaptation to heat portion that's sometimes often missed in a lot of our research. So we work a lot with social scientists and with community stakeholders to work on our communication to New Yorkers specifically for this reason. And so some of our heat adaptation programs are tailored in different ways because different communication methods work better for others. So maybe the alerts on your phone weren't the best communication method for you because they're so annoying. Maybe another method might be a little better, and you would still be able to feel informed, but be able to make an informed decision about what you do for the day.
And it was just stressful every day. It was urgent. You get a notice from the daycare. It starts with urgent. And you're like, oh, goodness. It's the air quality again. Okay. It's like, doesn't mean it's not urgent, but what's the right, there's other urgent things from the daycare you really worry about. So anyway, this has been a great conversation. I just want to say thank you all to our panelists. Thank you to our engaged and awesome audience out there in YouTube and Facebook world. Thank you so much for participating today in this session, for your ongoing participation in the Environmental Justice and Health Disparities Conference and over the next few days. Hope to see many of you in person on Thursday. Enjoy the rest of the conference. Have a good day. Thank you.